When experiencing lower back pain, we usually assume the spine is damaged, but this amber tension points to severe compression in the hip flexors. This compression is a direct result of how we spend our days. Sitting for hours holds the primary muscles running down the front of your body in a tightly locked, permanently shortened position. It acts as a biological bridge, anchoring to your lower lumbar vertebrae and tying into your femur. When pulled tight, the shortened psoas yanks the spine forward, tilting the pelvis and grinding the lower vertebrae together. Massaging or treating the lower back only addresses the symptom of this mechanical chain reaction. To achieve permanent relief, you have to release the tension pulling from the front of the hips. To trigger that transition, you need 3 things: a flat surface, a wall, and a strict commitment of 10 minutes a day. Step 1 is cat-cow. Before we can isolate the hips, we need to restore basic spinal mobility and get the pelvis moving fluidly again. By alternating between anterior and posterior pelvic tilts, you actively decompress the lower spine. Step 2 is child's pose. By sinking your hips back toward your heels, you apply a gentle preliminary elongation to the entire pelvic floor, which has been deeply compressed by sitting. Now we move to the core of the protocol. Step 3 is pigeon pose, which serves as the primary mechanical lever for directly targeting and stretching the psoas. The grid shows exactly why your hips must remain perfectly squared to the floor. Notice how correcting that alignment forces the extended leg psoas to bear the full weight of the stretch. Step 4 is the supine twist. While pigeon isolates the psoas, this twisting motion acts like a sponge, wringing out the residual tension stored in the surrounding fascia and oblique muscles. We move into legs up wall, transitioning from active muscular stretching to passive nervous system regulation. Elevating your legs against a vertical surface reverses gravitational pull. This assists in the return of blood and metabolic waste from the lower extremities, allowing the pelvic floor to release its protective bracing. As these nerve pathways shift from a high-alert sympathetic state to a calm parasympathetic state, the brain stops sending the signal to produce high levels of stress hormones like cortisol. Mechanical stretching is temporary if your brain still thinks the muscle needs to brace for impact. You have to retrain the central nervous system to accept this new, elongated resting length. This visual lays out your complete protocol: cat-cow, child's pose, pigeon, supine twist, and legs up wall. To be effective, these 5 steps must be executed in this precise anatomical order. If you treat this routine as a one-time intensive fix, it will fail.